Welcome to the Arizona Department of Health Services Heat and Sun Safety Training webinar for the Arizona State Parks and Trails. My name is Matthew Roach. I'm the Climate and Health Manager at the department in the Office of Environmental Health. We will have a little bit of an interactive portion during this presentation using a website called Slido, and we'll have some participant interaction if you go to slido.com, if you open up another browser. Alternatively, if you have a smartphone with a camera, you can put your camera on this QR code and in the hashtag HEAT, which is for the participant ID. And we'll do a quick, brief, fun question in the beginning to get everyone's. This is optional, but I think it is an interesting question to see what the answers are from the audience. We have 29 people here today, so we'll get started in a second. So the first question is, what Arizona city has the highest recorded temperature to date? We'll give it a minute. So we have 11 responses so far, and we see a few answers like Havasu, Gila Bend, Phoenix, Yuma, Bullhead City, and Ajo. All good choices. Needles. All right, it seems like the answers are slowing down. I think with this word cloud and the largest word here being Lake Havasu, you are correct. Lake Havasu City was 128 degrees. So thank you all for joining this Slido question. This will just get a little bit of taste of this. We're just going to do one question for now, and between our presentations up with some more Slido questions. So we have a quick agenda to show you. As again, I'm Matt Roach. I'm an epidemiology program manager over our climate and health program. We have two presentations for you today, 20-minute presentation from Nikki Lajavardi-Kosh as our epidemiologist in our environmental health. So our second presentation is from Sergio Perez, who is our Sunwise program manager, and will be talking to us about sun safety, where we're asking that you put any of your questions into the chat, and then our facilitators will moderate those questions, whether in chat or at the end of the presentation. And we will also have a chance during that to just go over any questions as they come up in the last 15 minutes. So our preferred audio is through computer, microphone, or speaker. But if you do not have a microphone or speaker, alternate audio is available through the phone. So the phone number is up on the screen. And you probably saw when joining the Zoom meeting, this webinar is being recorded so that we can provide the to those that are unable to attend during this event. And we will also be sending slide materials after the webinar to all registered participants. Some housekeeping, as mentioned before, we're asking attendees to mute themselves when they're not speaking and turn off video so that we can conserve bandwidth. And you can use the webinar chat to ask questions to our presenters. And then the meeting facilitators will compile questions for the presenters during each question and answer session. All right, with that being said, let's get started.
Good afternoon. My section of the talk is going to cover how extreme heat impacts our health. I will start by discussing some of the data on extreme heat and heat-related illnesses. I will cover the factors that can put anyone at higher risk for developing a heat-related illness and what the signs and symptoms are. Then I will discuss the appropriate action steps to take to improve symptoms and prevent heat-related illnesses. Arizona is one of the hottest places to live during the months of May through September. Weather forecasts with weeks in the 110+ degrees are not uncommon, and these extreme temperatures, if not taken seriously, can have detrimental impacts on our health. Every summer, there are numerous reports of residents and visitors hiking and needing to be rescued. In addition, each year, we have thousands of ER room visits and hundreds of deaths related to heat. In 2020, we saw an increase in the number of extreme heat days and heat-related deaths. The summer of 2020 was one of our hottest summer seasons. This calendar shows the number of days in each month with excessive heat warnings issued by the National Weather Service. The criteria for an excessive heat warning is a heat index of 105 degrees or greater that will last for 2 hours or more. In 2020, the heat warning started in late April, and as you can see in August, more than half of the month was designated as an excessive heat day. Also in 2020, we hit a record for the number of days over 100+ degrees. We had a total of 145 days with 100+ degree weather. This is almost 40% of the year spent in extreme heat conditions. So what kind of impact did these extreme high temperatures have on our health? In 2020, we saw an increase in the number of emergency department visits and hospitalizations due to heat-related illness. There were a total of 2,414 emergency department visits and 893 hospitalizations. COVID-19 was associated with a small number of these cases, accounting for only 15 emergency department visits and 33 hospitalizations. Heat-related illness occurred mostly among males aged 20 to 44 for emergency department visits and males 45 to 64 for hospitalizations. In both categories, we found mental health disorders to be a significant factor in these conditions. The two most common activities prior to heat-related illness, emergency department visit, or hospitalization was recreational or occupational. For ED visits, occupation, sport, and recreation activities were most common, while in the hospitalization group, occupation and recreation activities were most common. The 2020 extreme heat season also had an impact on heat-related mortality or deaths. In 2020, there were 520 heat-related deaths, with 7 associated with COVID. This is a significant increase from 2019, in which there were 281 heat-related deaths recorded. Heat-related deaths occurred mostly among males aged 45 to 64 years old. Substance abuse and being outdoors were significantly associated with these deaths. On June 1st, the first heat-related death was recorded for this year. This happened before we had our first heat wave last week. This is a tragedy because heat-related deaths are preventable. I've talked about the impacts of extreme heat in terms of data, but what are the symptoms of heat-related illnesses? What puts you at risk? And what steps do you need to take if you or someone you know are experiencing symptoms? Heat-related illness occurs when the body becomes too hot and is no longer able to regulate its own temperature. There are several factors that can put anyone at higher risk for developing a heat-related condition. Some of these factors include obesity, fever, dehydration, prescription drug use, heart disease, mental illness, poor circulation, alcohol use. Overall, the heat is hardest on the very young and the very old. Those with underlying medical conditions like obesity and cardiovascular disease, as well as those with disabilities, are commonly more susceptible to heat-related illnesses. The use of drugs and alcohol may also make one more susceptible to heat. Pregnant women are also at increased risk for heat-related illness, as their body has to work harder to cool down both mother and child. Certain prescription medications, such as antidepressants and diuretics, and those dealing with conditions such as Parkinson's, insomnia, and poor circulation, may affect a person's ability to cope with the heat. Symptoms of heat-related illness include the following: high body temperature, dizziness, fainting, rapid heartbeat, confusion, disorientation, as well as the others listed on this slide. There are different kinds of heat-related illnesses. The two most severe are heat exhaustion and heat stroke. They have very different symptoms, and it's good to know the difference so you know when to call 911 for help. I will go over the different kinds of heat-related illness from least to most severe and their key differences. A heat rash is one kind of heat-related illness. This rash occurs as a result of skin irritation due to excessive sweating. The symptoms could look like a cluster of red pimples that can appear on the neck, chest, groin, breast, or elbow area. To improve this condition, reduce heat exposure and keep the rash area dry. Also, don't put any ointment or creams on the area. Heat cramps are another heat-related illness and are caused by low salt levels in the muscles. Heat cramps typically affect workers who sweat a lot during strenuous activity. Symptoms include muscle cramps, pain or spasms in the abdomen, arms, or legs. To help treat heat cramps, the affected individual should drink water and have snack or carbohydrate replacement liquid every 15 to 20 minutes and avoid salt tablets. Get medical help if the worker has heart problems, is on a low sodium diet, or if the cramps do not subside within 1 hour. Heat exhaustion occurs from excessive loss of water and salt from excessive sweating. The symptoms associated with this condition include headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, and elevated body temperature. To improve this condition, the individual should get into a cool place, drink liquids, and remove unnecessary clothing, including shoes and socks. Cool off with wet towels and cold water, and someone should stay with them until help arrives, and also seek medical evaluation. The most severe heat-related illness is a heat stroke. This occurs when the body cannot control its temperatures, and temperature may rise to lethal levels that could lead to permanent disability or death. Symptoms associated with the heat stroke include altered mental status, confusion, slurred speech, loss of consciousness, hot, dry skin, very high body temperatures, and seizures. These are life-threatening symptoms, and 911 should be called immediately. The affected individual should be moved to a cool place and cooled down with cold or ice water. Someone needs to stay with the affected person until medical services arrive. This graphic summarizes the difference between the two severe heat-related illnesses, heat exhaustion and heat stroke. An important point to remember is that heat exhaustion can be treated, but with heat stroke, medical assistance is needed and 911 should be called immediately. A couple of other precautions I want to mention in regards to heat and safety. The temperature inside a car can rise dramatically in a short period of time. Leaving a window open is not enough. Temperatures inside the car can rise almost 20 degrees Fahrenheit within the first 10 minutes, even with a window cracked open. This graph shows how within 1 hour, the temperature of a car can go from 80 to 123 degrees. Don't leave children, those who may need extra assistance to get out of a car, or pets in a parked vehicle. The heat also has significant impact on park surfaces. On hot summer days, the temperature of various park surfaces can reach to well over 110 plus degrees. The temperature of this park bench was 147, and the tarp on the basketball court was 140. Surfaces can become dangerously hot, and park goers should be cautious about using these surfaces during the summertime. Now that I have covered what heat-related illness is and corrective actions to take, I want to go over prevention strategies because heat-related illness is preventable. The 3 important steps to preventing heat-related illness are staying cool, hydrated, and informed. Stay cool. Seek air-conditioned room, avoid direct sunlight, wear light-colored, loose-fitting, breathable clothing. Check on a friend or neighbor and have someone do the same for you. For the community, it's important to note that if an individual is having issues with their AC, cooling centers are available. A cooling center or cooling shelter is a public location, typically with air conditioning, that has been designated to provide free respite from the heat. Examples include libraries, community centers, and shopping malls. Currently, we have a list of cooling centers available for Maricopa, Yuma, and Pima County on our heat safety website. We will drop links to these cooling centers in the chat. Stay hydrated. Drink water before, during, and after going outdoors. If being active, aim to drink 32 ounces of water every hour. Do not wait to drink until you are thirsty. Avoid alcohol, caffeine, and sugary beverages. Water should be your primary source of hydration. Sugary drinks like sodas can actually be dehydrating, and the excess sugar can have negative impacts on your health. Sports drinks can also contain excess sugar. These drinks were designed to replenish carbohydrates and electrolytes in high-intensity athletes, so unless you're engaging in strenuous physical activity, water is the best option to stay hydrated. Stay informed. Know when there are excessive heat days and plan accordingly. For several years, our office has sent out National Weather Service heat warning messages to an email listserv. Currently, over 3,000 Arizonans are signed up to receive heat alerts from us that have public health safety tips. Nearly 2,000 school officials have also signed up for our school heat alerts, which offer tailored messaging to protect students and staff during heat warnings. You can sign up for heat alerts on our website at azdhs.gov/heat. In addition to signing up for heat alerts, the ADHS website has heat safety toolkits for specific vulnerable groups like children, older adults, and outdoor workers. Another useful resource for staying informed is the OSHA NIOSH Heat Safety Tool. This is a useful resource for planning outdoor work activities based on how hot it feels throughout the day. It features real-time heat index and hourly forecasts specific to your location, as well as occupational safety and health recommendations from OSHA and NIOSH. Lastly, I wanted to briefly mention that the data for heat-related illness and other environmental health topics like asthma or cancer can be found on our Environmental Public Health Tracking website. Our Data Explorer tool featured here allows users to search by topic for data that can be displayed as maps, charts, and graphs. Please visit our tracking website to learn more about the impacts of heat-related illness in our state.
All right. So now we're going to get back into some Slido questions. Just a reminder, if you have any questions about the previous presentation, put them in the chat and we will answer those questions in the chat or wait till the discussion time. For those of you that may have exited out of Slido, you can again go to slido.com with the hashtag heat that you see here on the left side of the screen, or use the QR code to use your phone and open the website for this poll going on. So the next question is, what is the average number of hours spent in the sun while you're on shift at the park? So these questions will be relevant for our upcoming sun safety presentation. Looks like we have several answers with around 4 hours spent in the sun while they're on their shift at the park. All right, we see the poll numbers not moving, so we can move on to the next question. What part of the day are you most active outdoors? We have early morning from 5 to 8 a.m., late morning 11 a.m. to 12 p.m., early afternoon 1 to 3 p.m., late afternoon 4 to 5, early evening 5 p.m. to 7 p.m., and night 9 p.m. to 4 a.m. So some of the answers coming in, we have majority of people saying early morning. They are most active between 5 a.m. to 8 a.m., as well as the late morning. And then some in the early evening. Great to see that many of you are going in the early morning when the heat's not that bad, as well as in the evening time period when the sun is not as harsh on the body. So what sun safety methods do you currently use while working outside? And we'll find out more about some of these methods in the next presentation. So I can see the answer coming in, really good answers: hat and glasses, a sun hat, light colored clothing and lots of water covering up, sunscreen, a wide brimmed hat, very important, sunblock, clothing. Yes, these are all really good strategies. Yes, it's very important to stay hydrated while you're outside. All right, it looks like the poll seems to be slowing down. Thank you all for providing answers. I think these are all great answers, and we're going to hear more from our next presenter, Sergio Perez, who'll be talking about sun safety, but I think a lot of these will be covered and described in more depth of how they protect yourself from the sun. Thank you all again for joining us on this interactive Slido poll.
Hello everyone, and thank you for tuning in. Today we're going to be talking about sun safety and skin cancer prevention, as well as how to remain safe while out in the sun here in the state of Arizona. We're going to start by learning about the risks to overexposure to the sun. What can be dangerous and why is it important to know? What are those preventative measures that we can use to protect ourselves from harm from the sun? And how can we share our sun safety information with our friends, family, and others? Why is sun safety important? In Arizona, we average over 300 plus days of sunshine per year. With more days of sunshine, we can expect to have more possibility for overexposure to the harmful UV radiation coming from the sun. This can have both short-term and long-term negative health effects, as sun damage can accumulate over a lifetime. Sunburns, for example, can be uncomfortable or even painful in the short term, but did you know that reoccurring or serious sunburns can significantly increase the risk of getting skin cancer? Other harmful effects of overexposure to the harmful UV radiation from the sun are aging of our skin, eye damage, and the weakening of our immune system. Let's talk a little bit more about skin burns. Overexposure to the sun can cause the same type of damage as heat. A first-degree burn results in damage to the first layer of skin or epidermis. Skin with a first-degree burn can often appear reddish or inflamed. A second-degree burn results in damage to the first and second layers of skin, affecting both the epidermis and dermis. Skin with a second-degree burn will often blister and or thicken, which can lead to an infection. A third-degree burn results in damage to all three layers of skin and can even result in the removal of the first and second layers of skin. Skin with a third-degree burn can often appear red or purplish in color and can often require medical attention. It should be noted that a tan is also evidence of sun damage. Did you know that in addition to skin burns, Prolonged exposure to the harmful UV radiation from the sun can damage the elasticity of our skin, which helps it to appear youthful. It can also damage our eyes, weaken our immune system, and increase our chances of developing skin cancer later in life. Now let's talk about skin cancer facts. Did you know that the most common cancer in the United States is skin cancer? And a recent study from the American Cancer Society shows that 1 in 5 Americans is likely to develop skin cancer at some point in their life. But don't despair. Skin cancer is also the most preventable of cancers. And when detected early, the 5-year survival rate of melanoma is 99%. Now let's go over some of the skin cancer risk factors. If someone is fair skinned, light haired, or has light colored eyes, such as blue or green, if someone's skin burns or freckles, if someone has certain types or a large number of moles, if they have a family history of skin cancer, people of older age, and males in particular, males over females, have a higher risk factor. That said, the most avoidable factor is overexposure to those harmful UV rays from the sun. These sun safety tips will help to protect you and your loved ones from the harmful UV radiation coming from the sun. Using any one of these is a great way to start your sun safety practice. And the more tips we use on a daily basis, the more protected we will be. Before you know it, your habit will become second nature and you will provide yourself with great protection. Our sun safety tips include using sunscreen every day, wearing a hat and lip balm, wearing sunglasses, covering up, limit time in the midday sun, seek shade, check the daily UV index, and avoiding sun lamps and tanning booths. Choosing a sunscreen can be overwhelming. Let's take a look at some of the things you want to look for when choosing a sunscreen. Broad spectrum protection provides protection against both the harmful UVA and UVB rays coming from the sun. We recommend an SPF factor or sun protection factor of 15 or more. A sun protection factor of 15 provides protection against 93% of the harmful UVA and UVB rays coming from the sun. An expiration date. Sunscreen has an expiration date, and it should be noted that any sunscreen that has passed the expiration date will not provide us the protection it has advertised on its label. Also noteworthy are the key ingredients. As of today, the FDA has designated as safe both zinc oxide and titanium dioxide, while they are currently gathering information on a long-term toxicology study on other common used ingredients. That said, while the industry and other interested parties are developing further data, the public should continue to use sunscreens along with other protective sun safety measures. How sunscreen works. Sunscreen works by absorbing, reflecting, or scattering sunlight. Sunscreen should be applied at least 20 minutes before exposure to the sun, and it's important to note that sunscreen wears off, so reapplication should happen at least every 2 hours, with more frequent reapplications if you are perspiring or in a water setting. It's also important to note that sunscreen has an expiration date, and for the most part, that expiration date is going to be 3 years out from the manufactured date. Wearing a hat and lip balm offer great protection. When selecting a hat, we should select a hat with a wide brim, as that allows for the most protection for our ears, neck, and face. The hat should be made from a tightly woven fabric, or if possible, whatever Mr. Indiana Jones's fedora is made out of. Wearing sunglasses can be a great fashion statement, as well as a great sun safety method. Sunglasses protect our eyes from the harmful UV radiation from the sun, as well as the sensitive area around our eyes. When choosing sunglasses, we should look for those that block at least 90% of the harmful UVA and UVB rays. This is usually advertised somewhere on the lens or along the frame. It should also be noted that photochromatic lenses offer protection against UVA and UVB rays according to the American Academy of Optometry. Cover up. Clothing provides great protection against the sun's harmful UV rays. Long sleeve shirts and long pants are going to provide us with the most protection, and tightly knit or tightly woven fabrics are going to provide the most protection of those types of materials. It should be noted that clothes should fit loosely and comfortably, as that helps to provide the breathability of those fabrics while we're out in the hot sun, as we are familiar here in the state of Arizona, Also of note is that dark colors, while they do absorb UV rays, that might not be as feasible as long sleeve pants or long sleeve shirts might not be as feasible in those hot summer months. And we might want to use other sun safety methods if we're not going to be using those long sleeve shirts, long pants, or dark colors. Limit time in the midday sun. The most preventable risk factor for skin cancer is overexposure to the harmful UV radiation coming from the sun. That said, it's important to know that the sun's rays are strongest during the midday hours, that is between 10 a.m. and 4 p.m. With that knowledge, we should be able to plan our day accordingly and use other sun safety tips to help protect us against overexposure if we have to be outside during that time frame. Seek shade before you burn. Shade is a great way to help mitigate the overexposure to the sun. Buildings, trees, and structures are a good way to avoid direct sunlight. If you anticipate being mobile, consider using an umbrella, as that will also help to prevent the direct sunlight onto your skin. An important note is that clouds offer temporary shade, and while you may feel a little bit of relief from the sun, it's important to know that clouds offer very little in the way of UVA and UVB protection. That is to say, not much protection at all. What is the UV index? The UV index can be a helpful way in planning our day as it forecasts the strength of those harmful UVA and UVB rays that we've been speaking about. The higher the number on the scale, the greater the chance of sun damage. Of note here is that in a level of 5 or more should trigger you to use some of your sun safety methods. Make a plan. So now that we have gone over those sun safety tips, we should be able to utilize our UV index to forecast the day and anticipate if we will need sun safety measures in our day, and we will also know what measures are accessible to us. Supporting sun and heat safety in the workplace. I like to say that supporting these efforts is a team effort. That said, we want to promote sun safety behaviors with our team. We want to ask and inquire, do you need a hat? Hey, are you going out there without shades? Do you need a bottle of water? Would you like to borrow my umbrella? Those are all great ways to help support your team. You want to provide water stations and shaded areas for relief, especially for those outdoor work. Add sun safety to workplace policies and training. Thank you all again for joining us today. And should you have any further questions, curiosities, or concerns, please feel free to reach out to me as my contact information is on the screen. Again, I am Sergio Perez with the Sunwise Skin Cancer Prevention Program. Thank you.
Thank you all for listening to these two presentations. We will now get into any questions that you have. So a reminder, you can use the chat here on the right to add any questions that you have for either heat safety or sun safety. So we have one question here in the chat: to avoid salt tablets. Can you talk a little bit more about why salt tablets are not a good idea? Can they ever be used? So just a little about salt tablets. They've been used to treat heat cramps and restore electrolytes lost through sweating. And these salt pills aren't really recommended as they used to be, given that we have sports drinks that have electrolytes, including potassium, magnesium, and phosphate. According to the CDC, salt tablets should never be used unless a worker is instructed to do so by a doctor. So I would check with a doctor first. And like I mentioned, that some electrolytes can be restored by other methods like the sports drinks. I'm going to put an article about salt tablets in the chat. So put a little bit more from the CDC about salt tablets. So workers should drink plenty of water with their meals and snacks, not only to stay hydrated, but also digestion. Moreover, ingestion of too much salt can cause nausea and vomiting, which can worsen the level of dehydration already present. So we have another question about, do you have a list of cooling centers available in more rural counties? Nikki has posted cooling centers in Maricopa, Yuma, and Pima counties, but with some of the more rural counties, unfortunately, they don't have a list of cooling centers, but sometimes Salvation Army and Red Cross will put up temporary shelters, so you can check some of their websites for those pop-up centers. Additionally, there's other options that were mentioned in the presentation, such as libraries, public buildings, community centers, senior centers are a few places, shopping malls, to get out of the heat during the hottest part of the day. We have a question here. What measurements are used to determine excessive heat? There are two different aspects to this question for measurements of excessive heat. And when we look at the meteorological factors involved in whether we need to look at the ambient outdoor temperature, both the maximum and minimum temperatures, there are 4 weather forecast offices in Arizona, and each of them have different criteria. But generally what they do is they look at a 30-year climatic average, and whenever the temperature gets, say, above 97th percentile, then they will call that a increased heat risk, which will generally lead them to issuing a heat warning. So when you look at the temperature values of heat warnings in, say, Maricopa County, where we have a large number of 100-degree days, you'll notice that the temperature threshold is a little bit higher. And there's also a seasonality factor. In the early part of the summer, a lot of people aren't accustomed to the heat. So in May, generally, the Phoenix Weather Forecast Office will issue a warning around 107 degrees. But as people are more acclimated to the heat, by June or July, you'll notice that the excessive heat warnings will bump up to around 113 degrees. When we move to other cooler counties, say Coconino County, they have lower thresholds by which they issue the heat warnings. And that's because of that climatic average. So you'll see some of those in the lower 100 reach the heat warning criteria. When we look at the overnight lows, we know that if you're out in the heat, you also need time to recharge your body, generally going to an air conditioning building at night. And for those that are unable to cool themselves off at night, these high overnight temperatures that we're seeing in the 90, 100 degrees after it's say 115, 120 during the daytime, those temperatures won't provide the cooling off needed to restore bodily functions to proper thermoregulation. So we're talking about people that may not be able to afford electricity at home to turn on that air conditioning or fix their air conditioning, and people who are homeless. In terms of the symptoms for measurements of extreme heat, we talked about heat exhaustion and heat stroke. The difference between heat exhaustion and heat stroke is that above 130 degrees with a core temperature, that's when medical professionals will deem that the person has heat stroke. When your body gets a core temperature above 103 degrees, the organs will start improperly functioning, and this can lead to organ failure and possible death. The body's ability to sweat, which is seen in heat exhaustion, stops in heat stroke. So when you see some of these things, as well as the flushed skin, the rapid heartbeat, etc., the person being unconscious, these are all signs that we need to start looking at possible calling 911, especially when that core temperature reaches above 103 and the body stops sweating. So hopefully that answers that question. So it's looking like we do not have any more questions in the chat. I want to thank the presenters for providing their information, as well as those of you from state parks that are attending this webinar about importance of heat and sun safety in our state. We know that the heat is going to be upcoming, and that these steps can help to prevent heat-related illness. So all heat-related illnesses are preventable, and by taking the proper steps, we can reduce the impact to yourself, coworkers, your friends, your family, and we think this is an important issue, and we appreciate the time you took to listen to this event. I guess there is one more question here that we have. Is it possible to drink too much water and flush electrolytes? So yes, there is too much water. I believe that condition is called hyponatremia, and it doesn't happen too often, but one of the things that I would say that I see that has happened is that a person does not take water as they should. So generally, when you're working outside, you should drink water before, during, and after you go out. And there have been some instances in sports where someone doesn't do that drinking before and during, and then they're already dehydrated when they're outside. And so they try to recover the water in their body by then chugging too much water after. And this could lead to adverse health outcomes. So that's why it's important to remember to spread out hydration before, during, and after outdoor activity. All right, I want to thank everyone for joining today. And with that, hope you have a great rest of your morning.